The mission is simple: to help high achievers naturally eliminate emotional and physical obstacles so they can optimize their life for higher achievement. Welcome. You have just entered the Genesis Zone. Good day, and welcome to the Genesis Zone show. This is Dr. Brian Brown. Thank you for taking time out of your busy schedule to join us today. Depression has had and is having a significant impact around the world. But in the United States, it's affecting individuals, families, communities, and the overall healthcare system. With millions of Americans experiencing depression each year, it leads to decreased productivity in the workforce, higher healthcare costs, and an increased burden on the mental health care system. Now, depression can also contribute to social isolation, strained relationships, and a higher risk for suicide and other health issues, further exacerbating its toll on the nation's healthcare system and well-being in general. Unfortunately, the pandemic that we're coming out of in the last few years brought about a unique set of stressors and challenges that have affected people's mental health, not just in the United States, but worldwide. Several factors contributed to the increased burden of depression during the COVID-19 pandemic, and many of these are continuing on today. Now, these issues are social isolation, economic stress, fear and uncertainty, grief and loss, limited access to mental health services, disruption of routines, and impact on vulnerable populations. As of September 2021, the estimated annual cost of depression on the American population just in the United States is around $211 billion. Now, this cost encompasses healthcare expenditures, workplace costs of lost productivity, and other related economic burdens. However, these numbers are projected to grow exponentially in the coming years. So what are we to do about this? With all the hype about psychedelic-assisted therapies and mental health and different models that are emerging, are these modalities, these psychedelic-assisted therapy-type modalities, the answer? Well, we've spent quite a bit of airtime on the Genesis Zone show discussing mental health benefits of psilocybin. Now, today, I'm going to shift gears a little bit, and we're going to talk about another psychedelic modality called ketamine. Now, for those of you who may not be familiar with the name ketamine, it is an anesthesia drug. It's used in surgical type settings, but it can also be used in certain pain syndromes. I remember when I was in my training in the 90s, we used ketamine in the emergency room for pediatric fractures, say both bone fracture of the arm or the wrist. We would use ketamine for conscious sedation in the emergency room, and we would put the kid in twilight sleep, basically set the bones, cast it, and they wake up and they didn't even know what happened. So let's take a look at what the literature is saying about ketamine and depression. You know, this anesthesia drug that's been around for years, that we're just now starting to understand its role in the treatment of depression. In a recent double-blind placebo-controlled study, which is a very good study, by the way, conducted at the University of New South Wales with about 179 participants, and it was published in the British Journal of Psychiatry, researchers found that generic ketamine is just as effective as name brand ketamine in the treatment of treatment-resistant depression. Now, this is critical because when you treat clinically a treatment-resistant depression client, it's very difficult to treat, number one. And a lot of times when we switch from a name brand to a generic, the patient totally decompensates. Is that a nocebo effect, meaning a reverse placebo effect, meaning in their mind, they view that this change is going to cause them harm. Therefore, their mind sets them up for this harm? I don't know. Nobody really knows, but we know that it's a thing. So they wanted to look at name brand ketamine versus generic ketamine. And what researchers found was that 20% of participants in this study achieved total remission of their depression within a month. Now, they were receiving twice monthly infusions, IV infusions of ketamine, in order to ameliorate their symptoms of treatment-resistant depression. However, I have to tell you honestly, in all my years of clinical psychiatry, practicing old school Western medicine psychiatry, not the functional psychiatry that I do today, in my old days when I was practicing traditional psychiatry, a 20% remission rate was unheard of. I don't care what medication you use, and you need to know that treatment-resistant depression patients, people who suffer with this, they're not just on one medication. They're sometimes on 3, 4, or 5 different medications. It takes combinations of medications in order to get them the least little bit of improvement so they can function. Is their quality of life great? No, it is not great. But researchers in this study found a 20% remission rate with ketamine, basically 2 doses within 30 days, 20% remission rate. Unbelievable. Okay. They also found that those who didn't get a 20% remission rate, 50% of the population who received the generic ketamine actually got a 50% remission rate within a month. Now, if you talk to any person who struggles with treatment-resistant depression, they will tell you if they could get 50% remission of their symptoms, they would be golden. But they just don't get there. Ketamine seems to be able to do that. Now, in the world of prescription pharmaceutical medications and combinations of medication cocktails, these numbers, I can't emphasize enough, but these numbers are extremely impressive. Now, from the next study published in Biological Psychiatry, we begin to understand where the effectiveness of ketamine for treating depression comes from. Researchers in this study found that regular depression, just your run-of-the-mill major depressive disorder cases, respond with one particular small component of the larger ketamine molecule. And what they found is that this one particular small component can begin alleviating depression symptoms within as early as 2 hours. Now, again, for those of you guys who don't practice psychiatry or prescribe medications, or you're not in the mental health field, a 2-hour response on beginning to see alleviation in your depression is huge. It's really big, because the average pharmaceutical medication takes anywhere from 1 to 3 months to see any type of improvement. But with ketamine, we begin to see improvement within 2 hours. And again, another huge finding from this particular study. Now, that small component that I'm referring to within the larger ketamine molecule is what we call S-ketamine, ES. Now, people abbreviate that shortly and they put a S-ketamine, and that's okay. It just simply means that S-ketamine is a mirror image of the larger ketamine molecule. Now, why is that important? Why do we need a mirror image of a molecule when we already have the molecule itself? Well, if you or anyone you've known has ever been treated for depression, there are really good chances that they've been on a medication called Celexa, or its generic citalopram, or the medication Lexapro, or its generic S-citalopram. Get that? S-citalopram. Lexapro, or S-citalopram, is the mirror image of Celexa or citalopram. Okay. What we learned with this first mirror image version of a medication is that the Lexapro tends to be 4 times more potent than the Celexa. Okay. Now, I don't have those numbers to show you a comparison between S-ketamine and ketamine. However, truth be known, that the S-ketamine is where we start seeing these benefits for the treatment of depression within 2 hours. With ketamine, with the regular model of ketamine, you don't see that. It's the S-ketamine molecule that does that. Now, there's still a lot of information that hasn't been clearly understood about this mechanism and why S-ketamine works as well as it does. But that's all part of unraveling this mystery of how ketamine works in the treatment of depression. But it's another clue in the pathway of understanding how it works and why it works. Now, more recently, another study published in the Journal of Translational Psychiatry found that ketamine treatment can totally alleviate suicidal thinking within 24 hours in approximately 69% of patients. Again, these numbers are huge, and you just don't understand how important this is, because people get hospitalized over and over and over and over for suicidal ideation, suicidal attempts, suicidal gestures. They get hospitalized over and over. Imagine if we could take 69% of those patients and keep them out of inpatient units. Okay. And the cool thing about this study is that those numbers of those 69% who responded with decrease in their suicidal thinking, it seemed to remain consistent over a 6-week period. Now, I don't know about you, but a one dose treatment that can help 69% of the population and last for 6 weeks, that's huge. And that's similar to the studies we've seen with psilocybin, that we see these long-term effects. I'm going to get into why that long-term effect exists, even though the studies haven't shown this is why it exists. This is my thinking and my interpretation of why we see these long-lasting effects. And it has to do with neuroplasticity, which we've talked about on this show before. So up next is a study about that. So when we add to these studies, all the studies that I mentioned so far, what researchers at Yale University discovered when they found that another mechanism appears to be that ketamine literally regenerates synaptic connections between brain cells that have been damaged by stress and depression. Now, just in case you're not familiar, when our brains are subjected to stress of any kind, whether it be physical or emotional, the same as with our bodies, our muscles, our ligaments, our tendons, our organs, our fascia tissue, everything, when it's subjected to stress, physical or emotional, it creates an inflammatory process. And the nerves and the nerve pathways in the brain respond accordingly. They get inflamed as well. And this inflammation process causes a rise in what we call free radicals, which cause oxidative damage to the nerves and the nerve pathways, which ultimately disrupts the connections between those nerves so that they don't communicate as well as they should. Now, based on specialized imaging conducted by Yale during this study, after a person undergoes ketamine therapy, the nerve, or the synaptic connection, if you will, appears to be healthier. Actually, when you look at it on the imaging prior to receiving ketamine, the nerve is actually really thin and unhealthy looking, almost emaciated. And after it receives ketamine, it's very plump and healthy, and it has new pathways, new tentacles coming off of it. So it appears to be regenerating in these imaging studies. Now, this is huge, and it fits with the current thinking of why all psychedelics work so well to bring about positive neuroplastic changes in the brain that last for 4, 5, 6 weeks, even months down the road. In an even more recent study published in the journal Science, researchers found, and I quote, first, the drug, talking about ketamine, first, the drug somehow coaxes faulty brain circuits to function better temporarily. Then it provides a longer term fix by restoring the synaptic connections between cells in a circuit. And mind you, all of these findings come after researchers have known for quite some time that ketamine causes new synapses to be formed. In other words, neuroplasticity from the standpoint of repairing broken roads. Remember the road analogy I talked about in a previous podcast episode? It repairs the broken roads, it maintains those roads, and then it builds new roads. This is all neuroplasticity. And that's what these psychedelics do. That's what ketamine does. And so we're finding similarities among the MDMA studies and the ketamine studies and the psilocybin studies and the low dose LSD studies, we're finding these similarities throughout. So that's all I've got for today. If you're curious about what all this means and how I can be of assistance to you, feel free to reach out to me at Dr. Brian G. Brown. I'd be more than happy to answer any questions that you've got. Yes, we are doing ketamine assisted psychotherapy in the office. Again, that's one of those in-office things. I do have a connection with an international company that can do at-home psychedelic assisted psychotherapy. Again, those are extremely low doses. I'm not saying they're not helpful. I just see that what we do in the office tends to work a lot better than these lower doses. But you be the judge. If you're new to this and you want to experiment with it, ketamine is fully legal. I've talked about that on the show previously. These other modalities are still in research mode. They're still on the federal government watch list as far as being illicit drugs, but ketamine is not. Ketamine is legalized. It's available in all 50 states for the treatment of depression, post-traumatic stress disorder. We're now using it for traumatic brain injury. The list goes on and on and on. So that's all I've got for today. As usual, most informed, most trusted, and most grateful you spent this time with us today. Until next time, stay in the zone. I'm Dr. Brian Brown.